Hello and welcome to the hand hygiene topic in core clinical skills. By the end of this session, you should be able to understand the 5 moments of hand hygiene, know the indications of hand rub versus hand wash, understand and learn the equipment, preparation, and techniques of hand rub and hand wash, and finally, know the areas commonly missed during hand hygiene. Let's get started. Hand hygiene is a general term used to describe cleaning hands by using soap and water, antiseptic wash, or by using an alcohol based hand rub solution, or also known as ABHR solution. Hand hygiene is considered to be the single most important way to stop the spread of germs. So, why perform hand hygiene? It's done to reduce the risk of patient getting an infection, to effectively kill potentially deadly germs on the hands, and to reduce bacterial count on the hands. There are 5 moments in hand hygiene, and they are before having direct contact with the patient. You should perform hand hygiene before a clean or aseptic procedure. After contact with body fluids or excretions, mucous membranes, non intact skin or wound dressings, after having direct contact with the patient, and finally, after touching the patient's surroundings, it could be inanimate objects and medical equipment in the immediate vicinity of the patient. This is what you will need to do before performing hand hygiene. First of all, expose the hands until the forearms. Remove all hand or wrist jewelry and watches. Ensure the fingernails are clean, short, and artificial nails or nail products are not worn. And finally, cover all the cuts or abrasions with waterproof dressing. The equipment needed to perform hand rub is a bottle of alcohol-based hand rub solution. The following are the steps to perform an effective hand rub. Take an adequate amount of ABHR solution. Dip all the fingers of the right hand into the left palm with a hand rub solution. Pour the hand rub solution over to the right palm and dip all the fingers of the left hand into the hand rub solution. In that way, you get both the hands covered with solution. Rub the hands palm to palm. Then rub the right palm over the left dorsum with interlaced fingers and vice versa. Rub the palm to palm with fingers interlaced. Rub backs of fingers and knuckles to opposing palms with fingers interlocked. And finally, rub left thumb clasp in right palm rotationally and vice versa. The duration of the entire hand rubbing procedure should be done ideally within 20 to 30 seconds. What are the advantages of hand rubbing? It is more effective than soap. It requires less time. It's more accessible than hand washing sinks. It improves skin condition with lesser irritation and dryness compared to soap and water. And it reduces bacterial load on the hands. The equipment needed to perform hand wash is a plain or antimicrobial soap and water. Now, let's look at the steps to hand washing. First of all, rinse the hands with water. Take adequate soap in the palm of your hands. Rub the hands palm to palm. Rub the right palm over the left dorsum with interlaced fingers and vice versa. Rub the palm to palm with finger interlaced. Rub backs of fingers and knuckles to opposing palms with fingers interlocked. Rub left thumb clasp in right palm rotationally and vice versa. Rub left fingertips and thumb clasp in the right palm rotationally and vice versa. Rinse hands from fingertips towards the wrist. And finally, dry your hands with a clean paper towel. The duration of the entire hand washing procedure should be done ideally within 40 to 60 seconds. When do you wash your hands instead of rubbing it? when hands are visibly soiled or dirty, or caring for a patient with a suspected or known gastrointestinal infection or a spore forming organism. The areas commonly missed are fingertips, interdigital areas, and the thumbs. So ensure you follow all the steps of hand washing and hand rubbing to ensure that these areas are not missed. So, in summary, hand hygiene should be performed based on the 5 moments of hand hygiene explained just now. The duration taken to perform hand rub is 20 to 30 seconds with a total of 6 steps. The duration taken to wash hands is 40 to 60 seconds with a total of 6 steps. Remember to wash your hands when they are visibly soiled or dirty or when caring for a patient with a suspected or known gastrointestinal infection or spore forming organism. We have come to the end of this lesson. We hope it was insightful. Thank you.